Welcome back, everyone. As you can see, we're in full COVID attire at the moment. Mark and I are going to get back to you and bring you some more informational content now that you're in the peak golf season. This is typically where I see as well, Mark can comment as well, is where golfers who do their off season, they stop training in the on season. They pretend that golf is going to make up for all the deficits and all the exercise you do, and you lay off the pedal in terms of your on season training, and then you get these injuries creep up. So my goal today is going to take you through kind of the 5 most common injuries we see in amateur golfers, things to look out for, what you can do to address it, and when you need to seek some attention to take care of it. What do you see with people in season, Mark?
They don't exercise as much as we would like, and they think that fitness is their golf, and that's what happens. That's what happens. They get injured. And that's what we don't want to see. We want you to maintain your fitness level throughout the season so that we don't get injured and that you do play your best golf.
So next up, in terms of common injuries, are hip injuries. And oftentimes you'll see a correlation between sometimes a hip injury and a lower back injury because they're next door to each other and they work well together, and they can work kind of improperly if they're not working together. So for a right-hand golfer, kind of a very important hip here is the right hip, and the particular motion we're looking for is internal rotation. So Mark, demonstrate that, what an internal rotation looks like. Good. So it's being able to turn here. If you lack this, 2 common things kind of happen. You might start to sway, where you start to rotate that way, which puts a lot of tension on the outside of your hip. And if you have that on top of that, you might start to impinge a little bit, which might lead to a labral issue. Labral is kind of a nice lubrication surface, cartilage surface on the hip that allows it to move kind of frictionless, but it can be irritating if you can't do this motion. So what we're going to do is kind of find out, can an individual actually obtain that range of motion? Not everybody's built like a textbook, and we're not symmetrical down the middle. We have differences between Mark and myself, the way we're shaped, as well as the left side versus right side. So before I put you in a program or put you in a mobility program, I'm going to make sure your hip can actually do what it's designed to do. If not, I'm not going to push you through that because it's going to make you worse. So an easy test we can do is called the Craig's test. So most physios will understand this test. It might look kind of bush league in terms of the way it's done, but it's pretty reliable, and we're looking for the degree of range of motion depending on the hip left versus right to see how you're anatomically shaped. Some people are shaped with their femur more rotated inwards, some people are shaped with the femur more rotated outwards, just naturally, just the way they're shaped. So I'm going to try to find this out. So it's an easy test to perform. You're going to use your hands to kind of palpate, and we're looking for a number of degrees to see where you're shaped. And we'll do it a couple times for a sample size. So I'm going to have my hand here, Mark, you're nice and relaxed. I'm just looking in and out to see when a certain surface, the greater trochanter, comes out. Then I'd use an iPhone, I'll put it down the length here and take a look at the degrees. You'll see what it is relative to 0. A normal degree is kind of close to 12, 10 to 15 is the average, 12 is right in the middle there. If he's less than that, you can't get over here, he might be more in this position, that's more of an anteverted hip. If he goes past that, it might be more in the 18, 20 degrees, that's more of a retroverted hip, meaning that you can sit back up. He might be starting in this position naturally just because he's shaped, and you're pushing the person to this position, not going to help them. Or you might be starting in this position, and you're pushing him further, it's not going to help that person. So we got to find out how you're shaped first, and then work on some of the deficiencies, whether it's rotation or more of the sway. So with a hip injury, kind of a couple characteristics that get you to more of a hip issue is if you don't have thoracic rotation. So you can't rotate, then you'll be more inclined to sway over there to get that job done. That's going to cause a little lateral problem. If you have an S-shaped posture, once again, you're going to have a lack of mobility for the hip. You're more mobile in a neutral posture or that kind of posterior tilt we talked about, opening up that hip shape. And then if you sliding is going the opposite way for a right-hand golfer. It's posting up on this left hip, but instead of stopping, he keeps going. So when you normally swing, Mark, show him. Exactly, that hip doesn't travel over. It stops right there. That's a slide. And then this is a normal rotation. Exactly, so those things can lead to hip injuries. But before you start going on a crazy mobility program, make sure you're anatomically built correctly for the program.